Hashimoto's was first described by the Japanese doctor Hikaru Hashimoto in 1912. Hashimoto's is an autoimmune disease that attacks healthy thyroid tissue. Although it's one of the most prevalent autoimmune diseases, it's unclear as to what specifically causes it. Pathophysiologically speaking, it is suspected that there's a defect in suppressor T lymphocytes, which allows helper T lymphocytes to interact with antigens on the cell membrane. Then the lymphocytes become sensitized and autoantibodies are formed and react with antigens. Some important autoantibodies are thyroglobulin antibodies, thyroidal peroxidase antibodies, and TSH receptor blocking antibodies. There are, however, some known risk factors, such as being female. There's a 5-to-1 ratio as opposed to men. It can happen at any age, but mostly middle age. And lastly, having a pre-existing autoimmune disorder like type 1 diabetes or rheumatoid arthritis.
Some of the clinical manifestations are constipation in GI system, dry and cold skin, brittle nails and thick nails, and hair loss in intrauterine system, and it also causes it slows the heart rate and increase the risk of coronary artery disease in the cardiovascular system. And in the musculoskeletal system, it causes stiffness and pain in the muscles and joints. And in the endocrine system, it increases the size of the thyroid gland and cause weight gain.
There are other clinical manifestations in the body. In the pulmonary system, there is slow rate breathing, lack of oxygenated tissue, and harsh voice. In the hematopoietic system, there is anemia, which is a small number of red blood cells than normal, with high serum cholesterol. In the reproductive system, there is excessive and prolonged menstrual bleeding and problems with fertility, with increased rate of miscarriage. In the urinary system, there is fluid built up in the kidneys, with pitting edema. In the neuropsychiatric system, there is inability to concentrate, memory loss, and depression, with the increased sensitivity to cold. However, people with treatment to this condition will have a positive life expectancy as those without the Hashimoto disease. Thank you.
I'm going to talk about treatments for Hashimoto's disease. The first one is levothyroxine. It's a synthetic form of thyroxine used for replacement therapy. The benefits are weight loss, improved tolerance to environmental temperature, increased activity, and increased pulse rate. The side effects are palpitations, dysrhythmias, anxiety, insomnia, and heat intolerance. The second one is levothyroxine. It's a short-acting synthetic form of the natural thyroid hormone. The benefits are increased basal metabolic rate. It also affects protein synthesis. The side effects are tremor, headache, and upset stomach. The third treatment is corticosteroids. It's an anti-inflammatory drug. In patients with Hashimoto's disease, it is used to decrease the autoimmune thyroid activity as well as decrease inflammation. The side effects are peptic ulcer disease, muscle weakness, and mood and behavior changes.
I'm going to talk about the prevention. It is difficult to prevent the disease because it is an autoimmune disorder. However, early diagnosis and treatment is the best chance of preventing the disease progression. The best way to prevent the disease is to detect the symptoms early and know if you are genetically susceptible. If anyone in your family with thyroid autoimmune disorder, there is a risk factor for you, so you should get screened. Another method is to avoid the triggers which leads to hypothyroidism. Iodine-sufficient diet is necessary in preventing the disease. To sum up, such knowledge and awareness can help to prevent Hashimoto's disease.
I'm Malia Wahab.
Hi, I'm Tani Baldo.
I'm Jacqueline Vera.
I'm Jabal Sawam.
Hi, I'm Tenzin Somon.